Hi, I'm Ben Batey, Chief Health Officer at BGSU. Last week I talked about the Campus Clear screening tool, and today I want to talk about how you would use that if you would wake up and have symptoms, potentially be exposed to somebody, or have a fever when you check your temperature at home or in your residence hall room. So if you click any of those buttons, we definitely want you to stay off campus or stay within your residence hall room. At the same time, we want you to follow up with a medical provider to get the appropriate guidance for what the next steps would be. And you also can always follow up with Falcon Health Center. So you can give them a call, they can get you in very quickly for an appointment and potentially do a test for COVID-19 if the provider deems that that's appropriate. So then, once we see that, we want you to stay at home until that test result comes back. We want to wait to figure out where are we heading in this direction. Is it potentially that maybe it was some other symptoms and you test negative? Then you can come back to campus. But if you would test positive, that's where my team would jump into action, working to follow up with the individual to see, how long do they have to stay away from campus and who their contacts might have been. At the same time, we want individuals to report to us when they potentially would test positive for COVID-19. So if you're faculty, staff, or a student, you can always email health@bgsu.edu. And if you're a faculty or a professor or a supervisor and somebody reports to you that they've tested positive, you can let us know through that channel as well. At the same time, if you have questions, you can reach out to our COVID-19 response hotline at 419-372-3000. And finally today we're reaching the point where we're able to release an updated dashboard. So we did some numbers last week and now we're going to continually update that on a weekly basis. So we'll have a new dashboard for everybody to watch our numbers. And this will be released not only to faculty, staff, and students, but also to the general community. And you'll be able to watch those numbers as we work with different cases. Individuals who may be in quarantine or isolation in the residence halls or in our apartment space for isolation, as well as off campus. Our numbers did go up over the last, about 10 days, and we've been watching that. And we expected with, all these people coming back to campus, it was inevitable that we would have some cases. The vast majority of those cases are in residents who are off campus in the general community, and we're seeing this in households. So where you might have, 4 individuals who live together, and if one person tests positive, usually the other 3 are going to test positive as well. So we really want to remind people to limit their interactions to their sort of close-knit group, or those who you spend your most time with. When we start to interact with more than just a handful of people, that's where we can really start to see the spread and continue that forward. And so we all need to continue to work together, especially as we have gatherings or other different events, to keep that group very small and maintain that 6 feet of distance. So thank you for everything that you're doing, and we'll keep updating you as the weeks go on.